So Teresa, what first brought you to Puro? Where were you at regarding your health and just things that were going on? What was the main reason why you decided to come to Puro or at least try holistic care? What was it that brought you to us?
Well, I was having extreme pain in my both my knees, and my doctor actually told me, referred me to a surgeon, and he wanted to do double knee replacement surgery. And after looking at my MRI, I could see, I'm just a nurse, but I was looking at that, and I could see massive inflammation. I said, doctor, it's only been a couple years, but I have to try alternative. I have to try some alternative therapy.
Okay.
So, and I had heard about Puro from another patient, my,
Sure.
my dentist, and so that's how I first heard about Puro, and so I was invited to come to one of the dinners, and I had in my mind, I definitely want to try this. I mean, I was convinced when I came in because I want to explore every avenue I possibly can, because I want to really make some lifestyle changes to try to regain my health.
Sure.
Because somehow inflammation just set in my body, and taking steroids put a lot of weight on, lost a lot of mobility, a lot of flexibility, and some changes has happened in my life over a period of few years, and I find myself seriously thinking, do I have to go on a medical disability? Do I have to have this double knee replacement surgery, pain, recovery?
So when you were invited to our program and started, how was the program for you? Like when you actually got into the program and started implementing our suggestions, how did that work for you? How was the program?
Well, I found it to be very user-friendly. I mean, it was very gentle. I mean, I was encouraged to utilize this advice, and try to integrate these ideas in my diet, in my activities, my thoughts about my health care, and I didn't feel overwhelmed. I felt a real sense of support, and I felt a real camaraderie that everyone was here for the same reason, which was a wonderful feeling, because I felt like I could ask the staff anything I really needed to about my health care, about nutrition advice, and different exercises. I really love the fact that you had a little library here. You could, borrow some of the books and tapes. I found that to be so helpful and stimulating to think about, wow, what else is out there that I could look up? So I started investigating in related types of materials. So I really found it to be a springboard, because I liked how you had different things in your program, like, here are some recipes. Well, then it made me think, well, wow, maybe I could look up some other recipes.
Right.
To try to utilize. And then you had a massage class, and I said, wow, maybe I could see what other types of massage therapy are up there that could help me relax my muscles.
So now, in incorporating the program, as you elaborate, Teresa, what improvements did you notice, either right away or just either by the end of the program?
Oh, well, overall, I mean, I noticed I had increased energy, which really surprised me, because all my labs, I mean, I tested everything was really off a little bit, which I wasn't surprised. I mean, I really, realized some of the health problems I was having, my blood pressure, my sugar, inflammation. I was having a little bit of liver and enzyme. They were off, So when I tested back after doing the detox, I was really surprised. I mean, in a matter of 7 months, I mean, I took off more weight than I even thought I would, and gradually and safely. That was my major concern, because I didn't want to take it off too rapidly. And then in my labs tested normal, normal range. All of them were going A1C. Oh my God, my goodness.
It's a relief.
It was quite a relief, because that was well over 6 point, and then it became normal range again, and my blood pressure went down, so I was able to get off these 2 blood pressure medications.
So did you, in fact, come off some medications?
I did. Okay. I was able to reduce my blood pressure medications. I was taking 2 of them, and now I'm just taking 1 every other day.
Okay.
I don't need to take it every day, because then it affects my blood pressure too much.
Right.
But I just need a little bit, maybe when I finish my weight goal, I still lose a little bit more.
So how much weight did you lose?
I lost 35 pounds so far. Yeah,
Teresa,
yeah, I
that's
sure have. I
wonderful.
sure have.
That's wonderful. And
Thank
now,
you.
I do recall when you first came
Yeah.
to the office,
Yeah.
did you have a cane?
Yes, and I was actually walking with a cane, and I couldn't even walk up the steps. I was so embarrassed. I said, "I'll be there in a minute. Just go right ahead. I'll make it down." And I was walking one step at a time,
Okay.
one foot after another, holding both rails and hoping no one was
Yeah.
really paying attention how much I was grasping these rails. And it was difficult having to use a cane. It really impaired my work performance too. But unfortunately, I was able to work midnight shift, and I would walk down the hallway holding the rails. And then my patients really realized how much effort it was
Right.
for me to work. And a couple of them noticed, "Hey, you're limping quite a bit."
Right.
But now they notice, "Oh my goodness, your health looks so well and you look so youthful. No, you couldn't possibly be the age you are." Oh, and so many good compliments. You know, like
Good
you look
for
like you're
you.
glowing,
Good
and
for
you look
you.
like you're
Well,
doing
we're
great.
delighted. We are so delighted
Thank
for
you.
you, Teresa, both professionally and also personally. I know the staff here has really enjoyed having you. But you actually have finished your program with us, and I believe today you just had your first yoga class. What did you think about that?
Oh, I loved it. I absolutely loved it. And first I was apprehensive because I had never really attended a formal yoga class, so I didn't know what to expect. I was worried, could I keep up with everyone, especially since I've had knee problems. But since I've gone through the class and exercised, and I also attended physical therapy to help work my range of motion, and I was able to actually keep up with most of the poses, except the last two ones a little more complicated, which I will work on the downward dog. I will try that.
Good for you.
I'll get to that point in the next class. I know I will.
And so lastly, Teresa, just one last question. Where do you find yourself as far as quality of life?
I find myself having more energy, being able to do some of the things I've been wanting to do, like being able to actually get out there and, clean my garage, work more vigorously in my garden, because I have so many bushes in my flower beds which I want to change and rearrange, and be able to redo those things I've been putting off. Because I've had to ask people, my neighbors, my friends, can you please help me because I have a hard time kneeling, I have a hard time bending. Now when I go to actually take on some more activities I've been wanting to do and regain my abilities. Yeah, so it's a wonderful feeling to be able to be there and to accomplish some of the goals I've been wanting to do. And I just can't thank you guys enough.
No,
Really,
fine.
really can't.
Of course.
Yeah,
Well,
it's been wonderful.
we are happy the program worked for you and that you worked the program.
Yes.
So, Teresa, thank you for talking with us today. And
Yes.
of course, we always wish you the best of health. And you've come so far.
Well, thank you so very much, and I'm just so happy I found out about Puro. I can't think enough about